Okay, let's talk about opioids. Um, well, actually, we'll talk about opium and opiates. Then we'll talk about the war on drugs, and then eventually we'll wrap everything together. Um, yeah. So I wanted to talk about models of addiction. When we think about drugs, in fact, when we think about anything, when we say somebody is addicted to it, there's any number of things that we could be thinking. Right? One thing is we could think that they have an impairment of some sort. Um, Damn it, Otto, you're an alcoholic, right? That's just who you are. Um, and the treatment to that is really just, staying away from people that are addicts, right? There's another model, the medical disease model, which tends to think about addiction or dependence as environment manifested in some way, right? So it might have lots of environmental constituents, in which case the way to treat it is to take people out of their environment or to give them different ways of coping, maybe even give them drugs that are going to counteract their dependency on other drugs. Other people think that addiction isn't an impairment or a disease, but rather a choice. And so you are to be blamed if you've made the wrong choice and chosen to become an addict. Um, we've used all of these in history, and I think we'll continue to use each of these. There's other models, of course, but these are the three ones that I want to focus on. Um, let's do a little bit of history of opium. Opium's been around for most of written human history. In the 17 and 1800s, we began to think about ways that its properties could be weakened or that it could be used for medical or military purposes. Um, Depending on the time of history, addiction to opium was a property of the lower class or the wealthy, people with lots of time in their hands, or any number of other things. And lots of different drugs were derived from opium, morphine and heroin. We used these to treat lots of things and still use um, for very different purposes. We use them now. The book talks about heroin and aspirin being sold side by side. In fact, one being deemed to be more safe for children than the other. And it's exactly what you would not want. Opiates are drugs that are derived from opium. Right? So they're chemicals that are derived in a non-pharmaceutical setting. Morphine, codeine, heroin, heroin breaking down to morphine and codeine. Morphine's slower than heroin. Codeine is thought to be, we still use it in medical settings. Basically, all of these tend to have these same sorts of effects, right? Euphoria, relaxation, satisfaction, sedation, skin rash, a feeling of like floating, all of these things. People tend to really like them, and especially if they are in a lot of pain, this provides a lot of relief for them. It can also be quite addictive. In the United States, we've seen a rapid increase in opioid addiction and misuse of opioids, opioid prescriptions. Some of those have transitioned to heroin when they couldn't get access to more clinical drugs. And in fact, it's a pretty big problem, which we'll get into in a little bit. But first, I want to talk about the war on drugs. So we've had lots of legislation with respect to drugs in the United States. And this legislation bounces around a fair bit. I'm not going to ask you to know most of this. The point is that we've attempted to try to control importation and distribution of drugs in a variety of ways. In the 1970s, Richard Nixon declared drugs to be America's worst enemy and claimed that about 90% of crimes were drug-related. His administration would beat up on this over the news, and as we saw in the climate change section, at this time period, drugs become a top issue that people are worried about in the United States. Ronald Reagan leapfrogs Nixon and begins to push for mandatory minimum sentencing, forfeiture of cash, and real estate for drug offenses. We spend more on the war on drugs ever since than most other countries. In fact, the next several countries combined. Millions of people are arrested every year, costing the United States billions and billions of dollars. A lot of these people tend to be black or brown. So when you look at this map of incarcerated Americans, we see that really it's during the Reagan era that with sentencing reform that the United States really becomes number one in the world, both in terms of raw number of prisoners and of percentage of population as prisoners. We have more prisoners than anywhere else. So we're number one. And it's largely due to these nonviolent drug-related offenses, which in the 70s and 80s, people were arguing were causes of other more violent crimes. And in the moralistic 70s and 80s, with the bringing of religious church leaders into American politics for the first time, this became a rallying cry, along with several other things that we've discussed and will discuss. So when you look at the addiction rate from the moment we decided to declare war on drugs to now, hasn't really changed. We have spent a lot of money. So insofar as you're looking for a place to put a lot of money, drug control is a place to put it. Billions of dollars. It's quite a bit. I'm told never to mix my y-axes, but I think that's a fair way of mixing them there. There's risks with respect to public health for the United States having such a large prison population. And we are experiencing and will experience those risks in the near future with respect to the coronavirus. Iran released a lot of their prisoners as soon as the outbreak got out of control there. The United States has more prisoners than anywhere else. And a lot of our prisoners were arrested in the 70s or in the 80s. So they are 30 and 40 years plus 18, right? So in their 60s and 70s. They're a very vulnerable population. And because we have overcrowded prisons and lots of prisoners that are the vulnerable populations, black and brown, poor, elderly populations, this is a fairly scary, from a public health perspective, of what will happen to the prisoners and people that work in and near prisons and society at large. Well, we haven't yet gotten to coronavirus, so I'm just foreshadowing that here. One thing that I want to point out is we spent a lot of money on the war on drugs, and it seemed to have no effect on curtailing drug use. In 1994, John Ehrlichman, who had been high up in the Nixon administration. In fact, was a central figure in Watergate. Admitted in an interview that Richard Nixon used the war on drugs merely as an excuse to berate his political opponents, hippies, the anti-war left, African Americans, with the explicit aim of disrupting those communities. In the United States, more than 1 out of every 4 Black men between ages of 18 and 49 has been in prison. So has this fully disrupted those communities? We might compare what happened in the United States with what happened in Portugal. Portugal is a country with a much smaller population. It's a much smaller country. It's more homogenous in a variety of ways. But they had a drug problem in the 90s. And instead of criminalizing it the way the United States did, they decriminalized personal possession. It was very controversial. The right in Portugal had a huge problem with this. But over the next several years, illegal drug use declined, rates of new HIV infections dropped, and people began seeking more and more treatment for drug addiction. It is a huge improvement, and the libertarian think tank, the Cato Institute, says that basically by every metric, decriminalization in Portugal has been a resounding success. It has decreased the cost to the Portuguese people, enabled the government to manage and control the drug problem better than virtually any other Western country. So that's the United States and Portugal. So now let's see if we can tie all of these issues together. Opioids and social change and drug policies, and talk about, I used to use animations. In the United States, the average life expectancy 120 years ago was 47. Now it's in the late 70s. I have another graph that gets into the exact numbers coming up soon. There's lots of reasons why this is the case, and we'll spend more time on each of these later on. But when you think about some things that we've developed more and more drugs. It's not obvious all of them are good. Some drugs can be pretty fatal if you have too much, right? Like if you have too much heroin, apparently too much nutmeg, you can die. Opioids, which we'll get back to this, the opioid crisis now, are in the more lethal than alcohol range. When we look at US drug deaths over time, they seem to have increased drastically. 3/4 of drug deaths involve opioids of some sort. About 1/3 of heroin users die violently. And we have millions and millions of Americans abusing opioids. Largely, these are relatively poor white people in rural America. But many of them have transitioned from opioids to heroin, and it's cost billions of dollars and millions of lives. And it keeps growing. It keeps getting worse. And when you map up the United States deaths of despair, you can see that we are dying at a much, much faster rate, accelerating rate due to opioids. Suicides roughly remain stable, but we have lots and lots of deaths of despair, more so than the rest of the world. which has led to our life expectancy decreasing relative to its peak in about 2013 and 14. That said, of course, there's lots of other reasons life expectancy has gone up, and when we get to the vaccination lecture, we'll see some of those reasons even more. Overdose deaths are the number one cause of death in the United States for people of a certain age. Killed more people than motor vehicle accidents, than died in Vietnam. In a single year, more people die from overdosing on opioids and opiates than die from gun violence or than die from any number of other things. HIV in a given year. The entirety of the wars in the Middle East, we beat every year with respect to opioid deaths. And you'll notice this big difference when we go back to these models of addiction between how we treated drugs like marijuana and cocaine, well, not cocaine so much as crack cocaine and other drugs, when the populations that were using them were not politically advantageous, didn't have lots of power, right? So black and brown minority communities, they were treated as choice or impaired, using the choice or impairment model. But now that we have this opioid crisis, it's actually very, very serious, but it's affecting a constituency that is politically expedient to try to win over. We've been treating this as a medical disease, right? We haven't locked up a lot of these people for 20 or 30 years. I'm not passing judgment that we should, but it's interesting to know how we've fundamentally changed how we think about this. Even though one might say that drugs are drugs, and if it worked for Portugal, maybe the same approach could work here, treating not just opioids, but other drugs as medical or disease or addictions of a medical nature. Okay, I believe that's it.